Hi there, my name is Rebecca Shalev, and I'm currently working at the Child Study Center's Autism Spectrum Disorder Clinical and Research Program. And today I'm going to be talking to you about pediatric feeding challenges. To begin, I'd like to discuss the significance of eating and provide an overview of common challenges experienced by children with feeding difficulties. No human activity has greater biological or social significance than eating. During infancy, appropriate physical growth is one of the primary measures that we use to assess a child's health and development. To many parents, meeting feeding milestones is an affirmation of their competence. It helps them to feel confident in their skills as new parents. In turn, when feeding problems emerge, parents often express feelings of rejection and inadequacy. Yet we know that feeding difficulties are quite common in children. In fact, most exhibit difficulties during meals at some point during infancy or childhood. Picky eating in particular is a normal and often fleeting problem in the toddler and preschool years. During these times, children may demonstrate strong preferences for a few foods or certain types of foods and reject many others. The majority of the time, feeding difficulties experienced by the general pediatric population resolve without intervention or are relatively easy to treat with intervention. For example, a child who stops eating during a viral illness will typically begin eating once again when the illness resolves. But for some, feeding problems persist and worsen and require the use of targeted strategies or even professional treatment. A pediatric feeding disorder is identified when a child is unable to or refuses to eat food or drinks sufficient in quantity or variety to get the necessary nutrients that they need to sustain weight, maintain proper nutrition, and grow. The consequences of feeding disorders range from mild to severe and include malnutrition, which may result in inadequate weight gain or loss, dehydration, electrolyte imbalance, compromised immune function, impairments in cognitive, emotional, and/or academic functioning, and a dependence on feeding tubes. We view eating as a complex chain of behaviors that begins with accepting food into the mouth, forming that food into a bolus, chewing if necessary, elevating the tongue and propelling the food backwards through the oral cavity, and then swallowing the food. I'm presenting these steps in this way because difficulties with eating can occur in one or more phases along this chain. It's critical to keep in mind that challenges with eating often evolve as a result of multiple biological and environmental factors. In children with histories of developmental disabilities, such as autism or chronic medical problems, such as reflux, are more likely to develop problems related to eating and drinking. So what behaviors do we typically see in children with eating challenges? Especially in children with spectrum or other developmental disorders, we're likely to encounter selective diets. For example, children may only eat certain types of specific foods like Domino's pizza or Kraft mac and cheese, or foods of certain textures, such as foods that are smooth and creamy. We also see inappropriate behavior, so children may push away their plates or turn away from the food or utensils during mealtimes. They may also cry. Another challenge we see in some children is the need to follow specific rules during meals. So this may translate to needing the food to be presented in a particular way with certain utensils. Recent studies have shown that the most common feeding problems among children with developmental disorders is selectivity by type. In other words, children with these conditions are consuming very specific foods or foods within very specific contexts. For example, a child may only eat pizza on a particular plate. Caregivers of children with ASD in particular have found that their children are slow eaters at 6 months and have late introductions of solid foods after that time. They also continue to report difficulties specifically describing their children as very choosy from around 15 to 54 months, with parents more likely to serve their child on the spectrum specific food that's different than the food consumed by the larger family at 24 months. When food selectivity or food refusal emerges in children, we always want to be mindful of three essential considerations: the child's medical status, nutrition and growth, and oral motor safety. Regarding medical considerations, it's important to rule out physical causes such as gastrointestinal problems and a reaction to food allergies. Medical management should be the first line of assessment considered. In terms of nutrition, it's essential to assess the child's intake and understand whether they are getting the calories that they need to meet growth benchmarks. Finally, for children who have failed to progress with textures, we do need to have a sense of their oral motor safety. Do they have the mechanics and oral motor strength or even stamina to eat certain foods safely? Many children with feeding difficulties have food allergies. Although nearly any food is capable of causing an allergic reaction, only 8 foods account for 90% of food allergic reactions in the United States. These foods are soy, shellfish, dairy, wheat, tree nuts, fish, peanuts, and eggs. Now that we've briefly reviewed the significance of eating and specific challenges that children may face, let's move on to discuss the strategies that foster strong eating patterns. Strategies to prevent feeding problems. When children are young, they often are more open to trying new foods. So when possible, present a wide range of food to children before they reach the 15 to 18-month mark, as they often become more resistant to trying novel foods after this period of development. Another strategy we can use to prevent eating challenges is to teach your child to communicate about hunger by relating food intake to appetite. So we want children to make a connection between their internal state of hunger with eating an appropriate amount of food. It's also helpful to have a variety of healthy foods readily available in the household while making unhealthy foods less available. We can maintain a healthy refrigerator and pantry. It is easier to present a range of healthy foods to your children while discouraging unhealthy or very selective eating. We know that kids learn by watching others, and sometimes parents' attitudes about eating can directly influence children's eating behaviors. So I always encourage parents to be mindful of their own eating habits and try to have a healthy attitude about foods. For example, if we want to increase how many new foods a child tries, parents may begin by pointing out when they try a new food. The focus should be on the behavior of trying something new and not necessarily on whether the food tastes good, because the behavior that we want to increase is the child simply trying the food. When it comes to planning meals, we recommend using a consistent schedule. This helps to build routine for kids, and it helps their bodies to recognize when they should be hungry. If you have concerns about how much food is eaten at mealtimes, would you see what kind of snacking your child does in between meals and consider adding snacks to the schedule? Another reason why it's helpful to use consistent mealtimes is because it can help you plan your day and make sure that you have enough time and energy for meals. When parents feel rushed and tense, so will their children. Children who are relaxed at meals are better able to attend to their internal hunger cues, enjoy eating, and digest their food better. Prior to beginning the meal, it's important for parents to decide the length of the meal. A good length for a meal is about 20 to 25 minutes. We also recommend presenting food on a table or tray while the child is sitting at the table or high chair. Sometimes kids struggle with the physical mechanics of eating. For example, children may have difficulty managing their utensils or managing their plates and bowls. So to reduce effort during meals, we want to provide children with appropriate items and equipment. So consider getting a plate or bowl with section to help your child be more confident in managing their plates and equipment. Now we move on to discuss strategies to use during meals. One of the most important things we can do to manage behavior during meals is avoid power struggles and threatening to force the child to eat certain foods. Rather than give attention to inappropriate behavior, we can focus on increasing appropriate behavior, and there are many ways to do this. Today, I'm going to break down 4 approaches that have been shown to effectively increase appropriate behavior during meals. The first strategy involves reinforcing appropriate behavior. We can also ignore undesired behavior when it's minor. It's really important to have a goal in mind of what we would like the child to do. while also being really realistic about building success. So we want to start small but think big. Finally, we can get creative by using our knowledge about what the child likes to help them transition to eating a wide range of foods. So reinforcers describe any consequence that follows a behavior that increases the likelihood that the child will engage in that behavior in the future. And we can use them as caregivers and parents to strengthen desired behaviors and also promote new behaviors and skills. There are different categories of reinforcers, and I'm going to discuss social reinforcers and tangible and activity-based reinforcers. Social reinforcers include any type of social attention, such as labeled praise, high fives, hugs, rub on the back, anything that's social and physical in nature. Tangible and activity-based reinforcers include enjoyable items, such as a favorite toy, preferred activities and privileges, including things like going to the park or watching a YouTube video. Research has shown us that praise and encouragement from parents can be used to guide children through the many steps it takes to master new skills and to develop a positive self-image. Further, we know that a lack of praise and attention for appropriate behavior can lead to an increase in misbehavior. So during mealtimes, we always want to focus our attention on providing praise for a variety of positive behaviors. These may include taking bites of a food, especially if it's non-preferred, eating or drinking independently, swallowing bites or drinks, trying new foods, sitting down at the table, and making statements about feeling full or statements that describe hunger. We know that praise is most effective at increasing appropriate behavior when it's specific and labels the desired behavior. It's also important for many kids to sound excited, so the child feels really good about performing the behavior. Our goal should always be to provide a lot of praise, so you can kind of catch them when they're doing the right thing or in response to them complying with a specific prompt. We want to look and try to praise our kids about 4 times for each prompt or redirection. Another way to reinforce or increase appropriate behavior is to use a reward in combination with our enthusiastic labeled praise. For reinforcement to work, we must pick items or activities that are highly preferred to the child. So let the child be really motivated to earn these rewards. To be most effective, we want to deliver the reinforcer immediately after the child engages in the appropriate behavior. The immediacy of the reinforcer teaches the child that appropriate behavior results in something positive. To help children learn to make this connection, it's often important to give small, frequent rewards at first, and then maybe later building in delays. Many parents effectively use discussion to discipline their child. However, discussion can often have the opposite effect on problem behavior if your child is trying to get your attention. You might be surprised to know that your children will misbehave to get attention, even if the attention is negative, such as being reprimanded. Therefore, we typically ask parents to ignore or respond neutrally to disruptive mealtime behaviors when it occurs, and instead focus our attention on positive mealtime behaviors. In this manner, we can teach children not only that problem behaviors such as crying will no longer result in what they want, such as attention, but also that appropriate behaviors, trying new foods, and eating work to get them all the attention that they want and need. It's important to remember to ignore the behavior, but not the child. If a child starts wiggling and popping out of his seat at the start of a meal, and this is the behavior you've chosen to ignore, continue with presenting the meal. The impulse to delay presenting the food while the child is wiggling or make the child stop before you present the food might need to be tempered as you focus on your job. Think about how and when to encourage positive behavior. If you use ignoring, you should also deliberately increase your attention when the child engages in appropriate behavior. So as soon as your child is sitting calmly in his or her seat, provide that labeled praise. It's important to observe and carefully determine if this strategy is effectively reducing the frequency of your child's inappropriate mealtime behavior. Patience and consistency are key. Some words of caution regarding planned ignoring. Be prepared. Problem behaviors that are ignored often increase and get worse before they get better. If you're not able to engage in planned ignoring, give in right away. Otherwise, this teaches the child I simply have to persist with the negative behavior to get what I want. Some problem behaviors cannot be ignored, especially behaviors that pose safety risks to the child or others. For example, a child who engages engages in aggressive forms of self-injury for attention should not be ignored without proper safety equipment. Similarly, a child who runs in places such as out of the classroom when it's mealtime or into the hallway at dinner could really pose a safety risk to the child or possibly bystanders. So if the behavior cannot be ignored, additional treatment and intervention are indicated, and a plan can be developed with a behavioral psychologist. One reason why reward programs fail is that parents or teachers make the steps so big that their children feel that earning the reward is impossible and give up trying. When we first start to think about setting up contingencies for children, we want to be ready to help them be successful. We need to be so thoughtful about the child, what they're currently doing, and what we want them to ultimately do. When we first introduce reinforcers or rewards, we want to feel confident that the child is capable of performing the desired behavior, and it's not too big of a leap for the child. So if you want to introduce a new food, like broccoli, you should start small. So a tiny bite of broccoli only. After the child experiences success with this, you may want to introduce a new expectation, maybe 2 small bites of the broccoli. Oftentimes, parents move ahead with presenting a typical size portion, and we know this can be daunting to a child, and the child may get upset. That might trigger them to show negative behavior. So just put the amount of food that corresponds to your reasonable expectation on the child's plate to begin with. Another way to increase appropriate mealtime behavior involves pairing a non-preferred food with a preferred food. For example, a child that doesn't like raw veggies might consider dipping them in a condiment or sauce that the child does like, such as ketchup or barbecue sauce, or maybe try putting cooked vegetables on pizza. Similarly, we can blend or mix together non-preferred food with preferred foods. So we can mix milk with a chocolate milk formula to make some chocolate milk, or add fruit to cereal or oatmeal. For kids that are having trouble gaining weight, this might also mean adding foods that are high caloric intake. So check with your pediatrician about mixing in butter to other kinds of foods that they're already eating. Now that I've told you about the things that you should do during meals, I have to spend about 2 minutes telling you things you should not do during meals. Number 1, do not complain about food. Remember, your children are watching you and learning from your example. Number 2, do not give your child attention for refusing to eat. This means no coaxing, begging, or pleading. Remember, children should earn attention for positive mealtime behavior only. Number 3, do not exchange or switch around your child's foods during meals. If your child whines when you present Brussels sprouts, do not take them away and offer a preferred food instead. This simply teaches the child that if they engage in the inappropriate behavior, they can escape the non-preferred food and get that preferred food instead. Number 4, if your child becomes upset during meals, do not give them toys. Again, this teaches your child that they simply need to whine to get what they want. So when should we seek professional consultation? If your child exhibits the following symptoms, you should consult with your primary care physician. Dramatic changes in eating habits that persist for about a month or more. Feeding skills that significantly lag behind other age mates or the general developmental level of the child. Finicky or selective eating results in poor nutritional context or interference with the child's social adjustment. Weight loss or failure to gain appropriate amount of weight or result in poor energy. We should also seek professional support when children are frequently choking, gagging, or coughing during meals, when the mealtime just feels like a battleground and is very stressful, and when the meals are very lengthy and that this is a regular pattern for you. Meal lengths over 30 minutes are actually the best indicator of a feeding challenge relative to any other target behavior. So take a minute and think about the length of your meals and try to understand if this is longer than what feels appropriate. And again, we can always seek professional support to get some ideas for how to approach a situation when a child is presenting with significant difficulty. You know your child better than anyone else. So if you think there might be a problem, it's definitely worth investigating. I have some slides, some resources here on this slide. Treating Eating Problems is an excellent book by Keith Williams, and I have some websites and electronic resources. The mypyramid.gov, choosemyplate.gov, and the Autism Treatment Network Toolkit. In particular, they have something around exploring feeding behavior in autism. Thank you very much for your time and attention.